Learning objectives. Understanding the difference between isolation and quarantine. Scenario view for ending quarantine and isolation. In a nutshell, isolation is when a person has the virus, and quarantine is when a person may have the virus and pass it on to others. Let's look at the CDC's video on this for further clarification. What's the difference between quarantine and isolation? If you might have been exposed to COVID-19, you should stay home. This is called quarantine. Quarantine keeps someone who might have been exposed to the virus away from others. You should isolate if you have COVID-19, whether or not you have symptoms. Isolation separates people who are infected with the virus from others, even in their own house. Quarantine is the most likely situation you might encounter, so let's review it again. It's used to keep people who might have the virus away from others. It helps prevent the spread of the disease when people may not be feeling sick or have symptoms. People in quarantine should stay home, separate themselves from others, monitor their health, and follow the direction from their state or local health department. Close contact is the key in determining going into quarantine. This is defined as when you are within 6 feet of someone who has COVID-19 for a total of 15 minutes or more. This is expanded for people caring for someone who is sick with COVID. And last, if someone with COVID sneezed, coughed, or somehow got respiratory droplets on you, that also would be considered close contact. When to start and end quarantine? You should stay home for 14 days after your last contact with a person who has COVID-19. For all of the following scenarios, even if you test negative for COVID-19 or feel healthy, you should stay home, quarantine, since symptoms may appear 2 to 14 days after exposure to the virus. This scenario covers the simplest quarantine example, a single instance of close contact with a COVID-19 positive person. Your last day of quarantine is 14 days from that date you had that close contact. As you can see on the calendar, the contact was the 1st. 14 days later, the 15th, the person is free from quarantine. In this scenario, we talk about when you have close contact with a COVID-19 positive person like a family member or roommate, and you're able to avoid close contact during their home isolation period. On the calendar, the last close contact day is the 1st. Adding 14 days to this takes us to the 15th, and this is the day that you can end quarantine. In this scenario, you are in quarantine and have another close contact with a person who is sick. So you ask yourself, do I need to restart my quarantine? Yes. You have to restart your quarantine from the last day you had close contact with anyone in your house who had COVID-19. Anytime a new household member gets sick with COVID-19 and you have close contact, you will need to restart your quarantine. Looking at the calendar, you start a quarantine on the 1st and then have another close contact on the 5th. This is the new quarantine start date. The 5th plus 14 days equal the 19th. The 19th is now the end of your quarantine period. In this scenario, you cannot avoid close contact with the person who is sick in your house. So how do you determine your quarantine start date? Your quarantine can start when the person who is sick ends their isolation period. On the calendar, the person starts their isolation period on the 30th and ends it on the 9th. This makes the 9th your quarantine start date. Adding 14 days to the 9th takes us to the 23rd, and this is the quarantine end date. You should now have a clear understanding of the terms isolation and quarantine. In addition, the 4 scenarios covered provide a better understanding of how long a person may be away from work and others during quarantine or isolation. If you have any questions, contact your supervisor or myself, Don Denning. My contact information is in Outlook. For additional resources, go to cdc.gov/coronavirus.